Did you know that living close to bars, pubs, and fast food restaurants could increase your risk of heart failure by 16%? That startling statistic comes from a recent study by the American Heart Association, which has shed light on something many of us might not consider daily: the significant impact of our food environment on our health. This comprehensive research examined the health records of over 500,000 UK residents over a period of 12 years. What the scientists discovered was quite revealing. They found that individuals living within 1 kilometer of 11 or more ready-to-eat food environments, like fast food outlets and bars, were at a 16% higher risk of developing heart failure compared to those who had no such establishments nearby. But what exactly does density of food environments mean? In the context of this study, it refers to the number of fast food joints, pubs and bars located within a short walking distance of one's home. The findings suggest that the greater the density of these places, the higher the risk of heart-related issues. This could be due to the increased likelihood of indulging in unhealthy food and drink options available at these venues, which are often high in calories, fats and sugars, all known contributors to cardiovascular disease. It seems our zip code might have more to say about our health than we might think. But before we jump to conclusions, remember, correlation does not equal causation. When we hear that living near lots of bars and fast food joints is linked to a higher risk of heart failure, it's easy to assume that these establishments are the direct cause of health problems. However, this is a classic example of the confusion between correlation and causation. Just because two factors occur together does not mean one causes the other. Lucci, the study's senior author, and Caroline Thomason, a registered dietitian, both emphasize the importance of understanding this distinction. Thomason points out that while the surroundings might tempt more frequent indulgence in unhealthy options, they do not compel one to make poor health choices. It's about a broader context, where multiple factors interplay to influence health outcomes. So while the environment influences us, it doesn't seal our fate. What if I told you that 50% of your health outcomes are determined by your zip code? It's a staggering statistic, isn't it? But this is not just a number pulled from thin air. It's backed by research and a well-regarded model known as the social determinants of health, developed by UCLA Health. Let's delve into this model to understand how it breaks down the influences on our health. First, a substantial 40% of our health outcomes stem from socioeconomic factors. These include our level of education, the status of our jobs, the support we receive from our families, and our income. Each of these elements plays a crucial role in shaping our health, often dictating the resources we can access and the choices we can make. Next, consider the physical environment, which accounts for 10% of the impact on our health. This includes the type of housing we live in, the safety of our neighborhoods, and the built environment around us. Living in a safe, well-maintained area can significantly enhance one's mental and physical health. Now let's talk about wellness behaviors, which make up 30% of the equation. This category includes our diet and exercise routines, tobacco and alcohol use, and even our sexual activities. It's clear that our personal choices in these areas are vital, but these choices are often influenced by the socioeconomic factors and the physical environments we discussed earlier. Finally, there's healthcare access and quality, contributing 20% to our health outcomes. This encompasses not only the availability of medical services, but also the quality of care we receive when we access these services. As we can see, these factors interplay intricately to shape our health. It's not just about whether there's a fast food restaurant or a gym nearby, it's about the entire ecosystem of our living conditions and the societal structures around us. Our environments shape us in more ways than one, often more than we realize. Imagine how changing your local food environment could transform public health. Across the globe, communities are awakening to the profound impact that local foodscapes have on their health. From the bustling markets of Barcelona to the green-thumbed neighborhoods of Portland, local initiatives are reshaping the way we think about and interact with our food. Take, for example, the Urban Food Policy Pact in Milan, which has inspired over 200 cities worldwide to commit to sustainable food systems. These cities are increasing access to fresh produce, while decreasing the prevalence of processed and fast food options. This not only supports local farmers, but also reduces the incidence of diet-related diseases. In the United States, initiatives like the Healthy Food Financing Initiative have been instrumental in transforming food deserts into food oases. By providing financial incentives to open grocery stores in underserved areas, these programs offer fresh fruits and vegetables where there were once only fast food options. Studies show that such changes are not just about providing nutrition, they are about creating new social spaces that foster community health and wellness. Community gardens are another beacon of change. In Detroit, community gardens have not only improved access to fresh produce, but have also become centers of social interaction and education, teaching young and old the benefits of nutritious foods and sustainable practices. Policy plays a pivotal role too. Cities like Amsterdam have implemented food environments policy that prioritizes health and sustainability by controlling the number of fast food outlets and boosting the availability of healthy, affordable food options. The results? Lower obesity rates and a population that is more engaged in healthy eating habits. Transforming food environments is not just about adding more green to our plates. It's about adding more life to our years. It's about creating spaces that nourish both the body and the community. Transforming food environments could be a key to unlocking healthier communities. While we can't choose our zip code, we can choose our dinner. Navigating the complex web of personal responsibility and environmental influence when it comes to making healthy food choices is akin to walking a tightrope. On one hand, our immediate surroundings often dictate the ease with which we can access healthy options. Bars, fast food joints, and convenience stores often crowd out the landscape, making the less healthy choice the easiest one. Yet, it's crucial to recognize the power of personal choice in this dynamic. Each decision to bypass the burger for a salad or to choose water over soda is a victory in its own right. These choices accumulate, building a foundation of habits that can withstand the convenience of unhealthy options. But what about when the healthy choice isn't just inconvenient, but almost impossible? This is where the role of advocacy and community action comes into play. By pushing for more nutritious food options in our neighborhoods, we can begin to change the foodscapes around us. It's about creating environments where the healthy choice is not only available, but also appealing. Supporting local farmers markets, participating in community gardens, or even advocating for better food policies at the local council can make a substantial difference. These actions not only increase access to healthy foods, but also foster a community spirit focused on wellness. Empowered decisions and community action can reshape our health landscapes. Today, we've peeled back the layers of how deeply our local food environments affect our health. Throughout this exploration, several key insights have emerged. Firstly, the density of ready-to-eat food locations, such as bars and fast food outlets, correlates with an increased risk of health issues like heart failure. This correlation, illuminated by recent studies, serves as a reminder that where we live can influence our dietary choices and, by extension, our health. However, it's crucial to recognize that correlation does not imply causation. Just because high-density food environments are associated with poorer health outcomes doesn't mean these settings directly cause health problems. Various factors contribute to this complex relationship, including socioeconomic status, lifestyle choices, and more. Understanding this distinction helps in making informed decisions about our health and lifestyle. Moreover, the concept of social determinants of health has been a cornerstone of our discussion. It's clear that our health is significantly shaped by the zip code effect, where socioeconomic factors, physical environments, and access to healthcare play pivotal roles. This highlights the importance of looking beyond individual choices and considering the wider social and environmental contexts that contribute to our well-being. Reflecting on our personal food environments can be an enlightening exercise. Consider the food options readily available in your vicinity. Are they promoting health, or are they obstacles to maintaining a healthy lifestyle? Recognizing these factors is the first step toward making positive changes. In light of these insights, it's vital to think about how we can collectively enhance our food landscapes. Whether it's supporting local food markets, advocating for healthier food options in our neighborhoods, or simply making more conscious food choices, we all have a part to play. By understanding and reshaping our food environments, we not only enhance our own health, but also foster healthier communities. Through informed choices and community action, the potential for creating vibrant, health-supportive environments is within our reach. Let's embrace this opportunity to transform our foodscapes for the betterment of all.